Good afternoon, everybody. We're just giving another 1 or 2 minutes for everybody to join us. We'll start exactly at 2 o'clock. Good afternoon, everybody. My name is Cecilia van der Scheide, and I'm from Bestmed Tempo. Thank you for availing yourselves to us today. Today's talk is all about drug awareness. Kindly ensure that your speakers are off during the talk, please. We'll give some time for questions after the talk. And then you're welcome to raise your hands and unmute yourself to ask the speaker directly, or you can type your question in the chat box and I will read it out to her. It is my pleasure to introduce our speaker, Shani Myburg, to you. Shani is an ex-addict and a drug counselor. She holds an honors degree in psychology, the role of senior addictions counselor in a nearby rehabilitation center, and she's been practicing in the field for 6 years. With extensive knowledge and experience in group facilitation, individual and family counseling, comorbid psychological, and addiction issues, Shani finds purpose and meaning in changing the negative perspectives of addiction and recovery. Welcome, Shani.
Welcome, everyone. Thank you, Cecilia, for that
The floor is yours. Thank you.
First of all, I just wanted to say thank you to Bestmed for putting something like this together. I think it's vitally important to bring awareness to such issues, especially like addiction. I think addiction is stereotyped across the world as bad behavior. I don't think if anyone thinks of an addict, they think of anything that is honest, or close to not criminal, to be fair. Unfortunately, addicts get a really bad rap, so do alcoholics. There's always this debate between, is it a choice? Do they choose to do this? Do they consistently choose to do this? And the debate of whether or not it really is a mental illness. And over the decades, there's been a lot of research, especially since the upcoming brain scans, and now that we've studied a lot more about metabolisms and so forth. It really is a mental illness. It is not a choice. I like to say to my clients sometimes, if it were a choice, do you wake up at 8 o'clock in the morning and go, you know what, I can't wait to steal the laptop, pawn it at 12 o'clock, forget my child at school, drive my child home drunk at 5 o'clock when I do remember. And when I do get home, I can't wait to have an altercation with my husband one more time about my drinking problem. It is not a choice. No one in their sane mind chooses to do that. And I use the word sane specifically because people who suffer from the disease of alcoholism or addiction are not in their sane minds. They unfortunately suffer from an obsessive compulsive disorder, very similar to OCD. Um, like people who have to pack their clothes in a certain way because it creates certain discomfort for them. It's the same with addiction as well. They've repeated the behavior so many times that there is a compulsion to do it, that the mind has basically stored it as memory as the only means of survival. Um, and over time, it actually just basically hijacks the survival mechanism. So when they're hungry, their mind goes use and drink. When they're lonely, the mind goes use and drink. And it just becomes the new survival mechanism. And I think why I bring up the bad behavior is because we like to talk about addiction as in terms of the allergy of the body. It's almost like an addict and alcoholic's body is allergic to drugs and alcohol, that they have an adverse reaction when they take substances. Now, this adverse reaction, unfortunately, doesn't break out in a rash or a fever or a temperature. It doesn't manifest that way. How it manifests is bad behavior. The best way to put it is when an addict takes a substance and they have the allergic reaction, they break out in handcuffs. And that's what makes it so difficult for people to get honest about, for them to want to approach their HRs, to approach their loved ones, for children to approach their families to go, listen, I have a problem. Um, they just think it's bad behavior and that if they just chose differently, we wouldn't be in this situation. Can you imagine, just as a metaphor, for example, if you were in the desert and you were dropped off in the desert for 2 weeks and you had no food and you had no water and you were starving, and you were thirsty and dehydrated, and you eventually walk up to this table and it has everything you desire, Coca-Cola, Sprite, glasses of water, burgers, chips, every desire, and you haven't eaten or had a thing to drink, for 2 weeks. And you walk up to this table, and as you reach for it, someone smacks your hand and says, no, you can't have that. I don't care if you're a nun, if you're a priest, if you are a family man, if you are a grandfather, if you are a saint. If you are put in that position, can you imagine what you would do to survive? You would probably do something that is not within your moral code, that is not within how you were raised, is not within your understanding of right and wrong. When you're in a state of survival, you will do things that you are not proud of in order to get what you need to survive. And unfortunately, that is how addicts and alcoholics' brains work. They will steal that very sentimental thing, that thing they said they would never do, they end up doing it. Addiction is also a progressive illness. At first, it could be experimental. It usually starts in teenagehood where it's quite normal to have drinks with your friends and go out on weekends. And maybe, you have a bit of a heavy day on the Saturday and then it goes into the Sunday and then Monday you have a terrible, terrible headache and you tell yourself you're not going to do it again. And then the next weekend comes and it wasn't that bad. Experimentally, it's normal to experiment with drugs and alcohol. It's actually part of the developmental phases of life. However, the disease of addiction is a progressive one. So we find a lot with our clients, what happens is in the beginning, it's a slow progression. So maybe it's only on the weekends, or maybe it's only when there's a social event, for example, and it's under control. It is not chaos. They still function. They go to work. They look after their children. They do what they need to do. They study. And over time, it starts to progress to the point where maybe now it's every Thursday. Puzza Thursday comes, and now Puzza Thursday is a thing. And now it's Thursday, Friday, Saturday, Sunday. And then it kind of rolls over into the Monday, and all of a sudden the sick notes start coming through. So I don't know. I know we've got a couple of people here who are corporate members, people who on an individual level, family members of those who might have someone who suffers. But one of the signs you'll start to see is that the sick notes on a Monday start coming through. And those are very often. Already you should know that something's not okay. And then it progresses to the state where it's not only on a daily basis. So perhaps they could get away with drinking 4 glasses of wine a night. Now it's drinking a bottle of wine to reach that same feeling. Over time, it's now wine and drugs. Maybe it was a certain drug and now it escalates to mixing different substances, to progressing to a stronger substance. And unfortunately, their body builds such a tolerance to it that despite negative consequences, and when I say negative consequences, I'm talking mental decay, emotional decay, spiritual decay, physical decay. Like, for example, they'll go to the doctor and the doctor says, listen, your liver is taking a beating. That does not stop them. So the DSM, which is our Diagnostic Statistical Manual, it's the manual that every mental illness around the world it's the criteria that they use to diagnose like schizophrenia or bipolar or depression. Addiction falls under substance use disorder. And how they classify it there is addiction is the continued use of drugs and alcohol despite negative consequences. So it doesn't matter if they start losing their family. It doesn't matter if financially they're starting to struggle. It doesn't matter if they start jumping from job to job to job because they leave before they get fired. They're very smart like that. It doesn't matter how their worlds are becoming unmanageable around them. They do see it, but that is not enough to stop them because they have a compulsion. Their mind tells them that if they don't take it, they will die. They will die. And that unfortunately cannot be treated with some sort of pill or medication. There is no medical cure for addiction, but there is a spiritual one, and that's a bit tricky, but we'll get into that later. But there is no way short of having a brain lobotomy or removing your a pancreas transplant or a liver transplant. Unless that happens, there is no cure for addiction and alcoholism. But like many other diseases, you can learn to live with it if you take the correct medication. So, for example, like cancer. If someone has cancer, there is no cure for cancer. However, there are high chances for them to survive longer if they do chemo. For diabetics, diabetes cannot be cured. There is no cure for diabetes. However, if they're on the right regime of insulin, change of diet, change of lifestyle, they can learn to live with diabetes and still have a successful life. Same with HIV. If they just take their antiretrovirals, they can live a happy and productive life. It is the same with addiction. The only difference is that the cure, the medication for addiction is not an actual medication. It's not like insulin, it's not chemo, it's actual behavioral modification. The cure is behavioral modification, and that takes time. We didn't get like this in one day. So that's basically what addiction really looks like. I could go deeper into it, and if you have questions, please write them down. I'm happy to answer them. Moving on from what addiction is, I'm going to just highlight a couple of what types of addiction do we get. A lot of people might categorize it as, okay, no, this is drugs and alcohol. No, we get what we call process addictions. So process addictions are not necessarily drugs and alcohol. It is a behavior that releases dopamine. It is a behavior that spikes dopamine just like drugs and alcohol do. So, for example, a couple of types of addictions that you get your eating disorders that you're looking at anorexia, bulimia. You get the ones where there's both of them, overeating, binge eating. Those types of things all fall under eating disorders. Then you get obviously your drugs, your alcohol. The others is codependency. So codependency is our addiction to people and not necessarily the actual physical human being. It's our addiction to how people make us feel. So if you think I'm a good person, I'm a good person. If you think I'm a bad person, I'm a bad person. In other words, my self-esteem and my self-worth is completely dependent on what you think of me and your opinion of me and your praise of me and your affirmation of me. So it's almost like my sense of self is developed and stays maintained based on what you think of me. A lot of rescuers and victimhood and perpetrators, those types of terms fall under codependency. It's our addiction to people. And this can actually happen in families very often, especially with parents and children. Parents can get highly, highly addicted to making sure that their kids are perfect, But what you're sending a message to your child that if it wasn't for you, they're not good enough. If they're not perfect, they're not good enough. And their whole self-esteem about their worth, how they see themselves, is completely dependent on whether or not you approve of them. And that can cause other addictions later on, where they try to escape that unrelenting standard of being perfect all the time. And then that kind of filters into alcohol and drugs and so forth later on. The others that you get is gambling, online, in casinos, gambling, betting, all these bettings, the lotto even falls under that, gaming, internet, social media. A lot of the social media platforms can be very addictive. I'm sure you've seen the TikTok craze, and I'm sure you've seen the Twitter craze with how many followers I have depicts my self-worth. That is also part of addiction. You get workaholism. It is a real thing where you're dependent on work to deal with your issues or to avoid your issues. What others do you get? I just went blank there for a second. So work. Oh, sex and love addiction is another one. This can be addicted to having sex, addicted to being loved. It could also be your addiction to not having sex at all. We call them asexuals. And this is someone who adversely cannot be touched or loved. It's like an eating disorder. It's quite backwards. So what you need to know about addiction is that any and all addictions is a dependency on something outside of ourselves to cope with our internal problems and our external problems. No idea how to do that or self-regulate. So, for example, if I'm depressed, I go to the casino to avoid my problems. So I don't have to deal with my stuff. I reach for something outside of myself that can temporarily create some sort of feeling inside. It's about manipulating the way I feel by using people, places, and things outside of myself. So it's not just substances, it can also be process addictions. I think if we're going to talk about drugs, not everybody knows what drugs are there. Um, I'm going to just touch on some of the drugs that are out there. So other than alcohol, I'm not going to go through the lists of alcohol. My goodness, we'll be here all day. But the types of drugs that you get is like your meth, tick, crystal. Those all fall into the same category. Just for awareness purposes, perhaps you suspect there's someone in your life that uses these types of things. What should you be looking out for? How do you know what it is, where it is? Okay, so your meth crystal tick looks like glass. So it comes in a little banky. I don't know if you remember, it's kind of like the little ones you get for your earphones. If you get earphones on a plane, it comes in a little plastic Ziploc bag. It's probably about this big and this wide. Usually drugs come in one of those. So if it's meth or tick or crystal, it actually looks like glass, like little glass particles that have been crushed inside that bag. Then there's cat. So cat is the craze at the moment in South Africa. It is the cheap man's cocaine, is what they call it. So cocaine is very expensive in this country. So cat is the lesser form. It's obviously cut with so many things that I cannot even start to tell you. Bath salts. There's a lot of horrible things. Chlorine, paint thinners goes into that. Cat and cocaine looks like a white powder, so it looks like baby powder. If that's it. Sometimes it comes in a brownish form, so it looks a bit yellow and it looks a bit brown. That is still cat. However, it has been mixed with a lot of heroin. So heroin is what gives it a brown yellow color. So even if you find the residue at the bottom of a bag, if you see it that it's a bit brown, it's more than likely cat, and it's been mixed tremendously with heroin. And that's what keeps the dealers That's what they use to keep people coming back. Then you get your marijuana. That can come in so many forms. I know it's legal in this country, but I do think it's important to talk about because the amount of clients I have worked with that are in psychosis purely because of marijuana, I cannot tell you how many. There is a 1 out of 3 chance that if you go into psychosis because of marijuana, that we can actually get you out of it. So if you go into psychosis, you're completely delirious. You'll be pouring tea bags on your head because you think the sun is shining. They go completely mad. There's no touch or sense of reality whatsoever. We do use medication to try and help them snap out of it. Unfortunately, only 1 out of 3 people come out of psychosis. Most of our institutions in South Africa, so we're looking at your Vista clinics, your Port View, all of the psychiatric clinics, Mamelodi Psych, um, those clinics unfortunately have such a long waiting list because 90% of the people that are in those facilities are in psychosis, and a lot of them are because of drugs. And when I say drugs, more specifically marijuana. So marijuana is an underestimated drug. A lot of people think that it's medicinal, but the amounts of clients I've worked with where unfortunately the light switch has gone down and we can't get it back up, um, is shocking. Is shocking. Normally, about 80% of our treatment centers at the moment are dealing with people who are smoking weed. And they normally, weed and alcohol goes together. So when they when they smoke weed, alcohol goes side by side with that. And because it's such a depressant, it shuts down the neural pathways to such an extent that it actually requires medication for us to switch it back on. It is devastatingly scary how many people don't come back. And then they have to be put in tertiary institutions for the rest of their lives. And a lot of the youngsters are coming in, between the ages of 17 to 24, just from marijuana, and they're all in psychosis. Um, and it's long before they even got a chance to live life. It's cheap, it's affordable, you can get it on every corner that you go to. Also, it comes in a little banky. It looks like the inside of a tea bag has been, or a cigarette has been emptied into the bag, and that's normally what weed looks like. It can come in food, so we call them edibles. That can be those your chocolate brownies, your muffins. Sometimes they come in little sweets as well. And these little sweets they're called edibles. But I mean, it's so vastly available. You can get it in so many shapes and forms. But I'm really, really scared for our generations that are using weed. Um, then you get nyape. So nyape is a combination of um, marijuana, heroin, as well as your antiretroviral drugs. So a lot of the ARVs are mixed with it, as well as a bit of heroin, and it usually comes in almost like a cigarette form. It looks like a joint of weed, but they smoke it. Primarily, they smoke it. And in Yape, you will see it immediately. It's the easiest way of put it is they go crazy. They go absolutely mad. There is no sense or rhyme or reason when they are using it, even 10 times harder to get off than weed. You get ecstasy, your party drugs. These are tablets. They usually come in a tablet form and they range from various colors, but they also come in little bags. So they don't normally just get handed out. They come in little bags as well. Heroin can come in many forms. Sometimes it's in a rock form. Sometimes it's in tin foil. I think a lot of people get confused between heroin and crack. So crack is the one, I don't know if you've seen on TV, where they take the pipe and they light it and then they smoke the pipe. That's crack. It's like a rock, a moon that they put inside of that. Heroin normally comes either in a powder form and they schnauf it. Sorry, that's lingo for taking it up their nose. Or they put it in a syringe and they inject. The scary thing about the heroin is that a lot of people share needles, and unfortunately, that is creating a massive health risk in our country because it's spreading HIV around. So a lot of our heroin addicts are HIV positive, and that's because they're sharing needles. You get your alcohol, ketamine, LSD, which is your hallucinogenics. So it almost looks like a piece of cardboard. It's a square piece of cardboard. And then they break off a corner and they put it on their tongue, and that LSD works through the cardboard. This is when you see people hallucinating, talking to the sky. They think the police are outside the window. That's usually your LSD. And then GHB is found very, very frequently in the gay community, especially with the men. It is a liquid form of ecstasy that is ingested through the bottom. So you find a lot of GHB in the gay male community because it is an easy way to get it into the bloodstream. Other than your illicit drugs, I think it's important to mention the prescription medication. Often doctors prescribe things for anxiety, depression, not being able to sleep, for pain. And because it's prescribed by a doctor, we think nothing of it. Unfortunately, prescription medications, alcohol, and heroin all fall into the same category of the hardest to get better from because they affect the physical nervous system. So, in other words, if they don't drink it, use it, or take it, their body goes into severe physical withdrawals. And those are the ones that usually overdose and die. The others are more like an obsession, it's more a mental craving. But when we're looking at prescription medication, it is as bad and as deadly as heroin. Um, and I think too many people think because it's prescribed by a doctor, it's not that bad. So what I'm referring to with prescription medication is codeine. Codeine you find a lot in your flu medications, you find a lot in your cough mixtures. Benzos. So benzos is the short word for all of your tranquilizers and your sleeping tablets. Your Urbanol, your Ativan, the things that calm you down, the things that help you sleep, your sleeping Dorminox, all those types of things. The other one is opioids, which is the same classification as heroin. Opioids are your painkillers. So your Mibulin, for example, you wouldn't think much about your Mibulin. Your Mibulin is filled with codeine. You can have an addiction to Mibulin just because of the codeine element. And then everything you take for anxiety and depression, there's many, many, many that have these various things inside. You find this addiction quite often with basically middle-aged women. You don't find it very often with men. My experience is that it's always middle-aged women or young teenagers who were misdiagnosed from the age of 13 to 14. They were diagnosed as bipolar or have borderline personality disorder. Um, there's a lot of misdiagnoses with the teenagers, and then they're put on this way too early, and then they can't get off. And then your middle-aged ladies, who struggle with stress and anxiety and sleeping problems and hormonal problems, they go to their psychiatrist. Their psychiatrists tell them, no, you've just got a bit of depression. You just need something to help you sleep and calm you down. And next minute, they're filling in their own scripts. It is highly, highly addictive and also easy to hide, especially in the workplace. It's exceptionally easy to hide this. One of the new ones that have come on the scene, I'm not sure if you guys know about, is called lean. You find this with the teenagers a lot. If you've got a youngster or know of a youngster running around with a bottle of Sprite, and the color is purple, lean. So lean is the mixture of Sprite and codeine, basically. So they go into their pharmacies, they're getting all of these cough mixtures. It's over the counter, not a problem at all. And it gives you the same buzz as it does alcohol. So the youngsters are now running around with Sprite, pouring the codeine in there, drinking it at school. They call it Fanta. So it looks like Fanta, it looks like they're running around with Fanta, but the reality is they're actually using. So I don't know if that's new information or if that's helpful, but perhaps that can spark some interest as well. I'm going to move on quickly to in that area, again, if you've got any questions, please just write them down for me. I'll answer them afterwards. I'm just going to run through. I'm now going to just talk about a little bit of the symptoms. So each one has a different symptom, and we will be here all day if I have to describe every single one. So I'm going to break it down a little bit for you. So when we're talking about our stimulants, so you get two types of drugs. You get your uppers and your downers. Your stimulants are the ones that keep them up, energized, and they keep moving. So immediately what you will notice in terms of what you should look for symptoms is shaking, like tremors, jittering, like constantly fidgeting, that kind of movement. Heart palpitations, a dead giveaway of your stimulants. If someone's on cat or meth, what happens is their mouth goes funny. So they start to talk and their jaw starts to go left and right, left and right. Their brain is working faster than their mouth. So they're basically doing this the whole time and they can't stop talking. Oh my goodness, they can't stop talking. So that's one of the things. Sweating, you will notice the sweat, obviously, because the body is heating up because it's running on energy. Lack of sleep, and a dead giveaway is that they're not sleeping. So yeah, sleep deprivation is a big one. It takes, I mean, on cat and meth, they can be up for 3 days. 3 days, no problem. You'll also find that they don't eat. Um, the food makes them nauseous. They don't shower because the hot water makes them nauseous as well. Their general hygiene goes down the toilet. So they're wearing the same clothes. They're not washing their house. Their house is filthy. They are so busy all the time that it's almost like they can't sit still. For some, you might find you never see them. So someone who used to come around a lot, someone who maybe your daughter visits like every week, and now there's always an excuse because they can't hide it. They get this gray, almost gaps in their eyes. Their skin goes like a gray color as well from malnutrition. And it's almost like their eyes get sunken into their head. Cat does that, heroin does that, crack does that, meth does that. All the blackness, they look like pandas almost. Their lips are always dry. Their skin is always bad. It's almost like they're scratching all the time. They've all of a sudden picking their skin. Those are normally your stimulants. And then obviously not sleeping, eating, general hygiene, or looking after themselves. That's in general what you will see with stimulants. When it comes to downers, when we're talking like alcohol, your prescription medication, these people tend to sleep a lot. So they're constantly in their rooms. They don't like to go out. They're very distant from other people. They can come across as depressed a lot, that they're just constantly depressed and tired. They suffer a lot of headaches. They will experience memory loss. It's almost like you'll tell them something and the next day they don't remember even having the conversation with you. Blackouts, sometimes they're just passing out. They tend to ding their cars a lot more than the stimulants because they're not with us. They're in a trance, basically. They look like they're in a trance or just very sleepy. They tend to bump their knees a lot or fall or trip or bump their cars or forget things. They can't remember where they put the keys and they're just very absent-minded. Their mouths are normally dry from dehydration all the time. So their mouths are very dry. Their lips are very dry. I think that's just a give or take what you would see a lot with depressants. And then I'm just going to give you a little bit of signs for eating disorders or things that you might want to look out for. With eating disorders, let's look at an anorexic, for example. The tricks of the trade that you might want to watch out for, obviously, is they wear very baggy clothing. So they're thin, but they wear baggy clothing or fur coats or fur scarves. So they make themselves look bigger by using bigger clothing. Okay, so anything fluffy, you'll find a lot of fluffy with anorexics. You'll find that if you are anywhere near them when they eat, obviously if they decline to eat, that's a sign. But what you normally notice is they play with their food. So they'll cut it into tiny little sizes. They'll move it around the plates a lot. as if they're eating, but they're not. They're actually making it very, very small, and they're separating it as far from the middle of the plate as they can. They're adverse to carbs. You will not find an anorexic with a carb on their plate. And also be careful of a serviette. They have a tendency to put serviettes near their plates so that while they're talking and having a conversation, they'll push a bit of it onto the serviette and then crumble it and put it in their lap. And then it looks like their plate is empty. Um, they also have a tendency to really like lemon juice. I know this sounds crazy, but lemon juice, any type of tea that is a diuretic. So they would rather live off diuretic stuff, your ginger teas, your lemon juices, your lemon waters. They would rather drink that. So there's some information about those. In terms of your purges, your bulimics. Your bulimics get something what we call the bulimia bloat. So it almost looks like they're pregnant. So because they vomit so often, there is a buildup of acid in their body. So basically from their chest down, their stomach starts to bulge. And it almost yeah, it almost looks like they're pregnant. We call it the bulimia bloat. So that's when it's at its really bad stages. They usually experience very brittle nails. So if you look at their nails, you will see they're very, very brittle. And if you look at their teeth, especially by their teeth, it's going yellow, very yellow teeth. Again, it's from all the acid that they're throwing up the entire time. They're throwing up nutrients. They're starving their brain of nutrients. So their hair in the frontier becomes very brittle. So that the hair is fine, but in the frontier, you'll see it's breaking. It's like little breaks of hair. Their nails are brittle, their teeth are yellow, and that's all from the acid that they keep purging. I think for that, open door policy is very, very simple. You'll notice they'll go just before meals and they'll go straight after meals. So in my industry, we have a 30-minute rule. You may not go to the bathroom for 30 minutes after you eat. And if you have a problem with that, then you definitely have a problem. I'm obviously talking worst case scenarios here. Not that odd, I feel nauseous and throw up. This is a way of them to expel the food so they don't take in any calories anytime soon. So that's just a little bit of eating disorder things to watch out for. I think in general, those are the physical symptoms. You do get the emotional symptoms, for example, anxiety, depression, shame, loneliness, tired. We get a lot of clients that come in and they say, I'm not an addict, I'm not an alcoholic, I have depression. And we go, okay, I'm not an addict, I'm not an alcoholic. I just suffer from a lot of anxiety and having a drink calms me down. Okay, so if that were the truth, then why would you drink and use if you know that anxiety and depression are the symptoms, are the results of extensive drinking and using? So basically, anxiety and depression are side effects of addiction. You can imagine if you're pumping stimulants into your stomach every day of the week, I'm pretty sure you're going to come across a bit anxious. You know, if you are taking depressants over and over and over, I'm kind of not surprised that you're feeling depressed. But unfortunately, the illness plays a trick on them and says, no, I'm depressed and this is the only thing that makes me happy. That we call self-medicating. So what I like to tell my clients is, okay, cool. How's about we work with it together? Hence dual diagnosis. We get you clean and we get you sober for a year. If there are still symptoms of bipolar, depression, anxiety, then we will take you to a psychiatrist and get you properly diagnosed. Because you cannot diagnose someone properly for anxiety and depression if they're not being honest about the 15 Ativan that they've been taking for the past 6 weeks. It's not a fair diagnosis. So there's always this chicken and the egg, the chicken and the egg. I'm not discounting that some addicts and alcoholics do suffer from depression and anxiety, but drinking and using is not going to help that. If you are taking medication for depression and anxiety and then taking alcohol, you might as well throw that medication in the dustbin. It cancels each other out. It does the opposite effect. So throw it in the dustbin. So you cannot treat mental illness and addiction separately. You have to do it together. So get them clean and sober first with the tools and the treatments and so forth, which I'll go in now. And once they're clean and sober, then whatever's left over can be fairly diagnosed, and then prescription medication that is not addictive can be prescribed. So that is a big thing that I think is important, because a lot of addicts and alcoholics land up in like a Vista or a mental health clinic. They go to a Port View, they go in there for 21 days, they get a couple of skills, they get put on medication for their depression, but their drinking has not been addressed. So they drink and they carry on drinking. And then they find that the medication's not working. So they go back to the psychiatrist and they up the dosage. Now we're on double the dosage of mental health medication, like bipolar meds, for example, but we carry on drinking, which cancels out the medication. Now you're getting seriously depressed, seriously suicidal. You cannot deal with them on a separate basis. It's only after our clients have gone to 3 Vista clinics, realize that medication doesn't help them, do they end up with us and then go, I think I have a drinking problem. So no, I would encourage rehab first, psych clinic later. And that's not an industrial thing. That's just uh, a more conservative way of helping someone and a less destructive way of messing with their mind and the chemistry of their brain. So a lot of the time they experience anxiety, depression, shame. Those are your emotional consequences. Some of the mental consequences or symptoms that you see, like I mentioned earlier, blacking out, passing out, psychosis, memory loss, paranoia, delusions, hearing things, seeing things, not remembering where we put things, and denial. It's almost like the denial is incredible when it comes to addiction. You can basically, on a platter, show your loved one or show the person, you've crashed your car, you're bleeding from your forehead. Here are the test results that your liver is failing. I'm about to divorce you because of your drinking. Your child is terrified of you. Here's a video of you drinking and passed out. And the alcoholic will go, no, man, no. No, it was just that night. You knew I was having issues with my mother that night. You can't use that as an example. And they can deny it. No matter how much you put in front of them, they can't see it. Denial is one of the biggest mental consequences of addiction. Where there is a denial, there's definitely alcoholism, for sure. And then the spiritual ones. A lot of addicts and alcoholics get to a place of despair. No matter what they do, what they take, what they drink, where they go, who they love, it's just never enough. It's never enough. There's this great sense of emptiness. They will describe it as a profound sense of loneliness, that you can put them in a room full of people, extroverted. They still feel absolutely alone, like they don't belong. They never got the manual. Why am I different from other people? So that's kind of what they feel like on the inside. No purpose or meaning, loss of self-esteem, loss of self-discipline. That's what you can expect to see. And I think, we can get into treatment, but maybe that will come in just now. But why rehab? Why rehab? Straight up, I just want to leave off with there is no shame in asking for help. Today, in today's society, as much as there is stigma, it is a mental illness. And I really want to emphasize this because a lot of people don't reach out for help, especially in the corporate world, especially with their families, especially kids with parents, because they get deemed wrong. It's their fault, it's their choice, their chaos, or whatever. Even worse, when you've got people in the workforce that really suffer from this, but they are terrified that if they ask to go to rehab, they're going to lose their job. If they get honest with their HR and say, listen, I have a problem, that they're going to lose their job. Some people cannot afford to lose their job, and they're really scared of being seen as that addict in the workforce, or in the company or whatever. I just want to be very clear for those who don't know. No company, it is illegal to fire someone because they have reached out for this type of help. If you reached out for mental health support, the company is inclined to help you find that support before they can let you go. They can't just let you go. You can't just call you in and say, "Bud, you've been drinking, blah, blah, blah." If you get honest and go to HR and say, "Listen, I'm in trouble. I'm in trouble and I need help," they cannot fire you. They are inclined to help you seek out help, just like any other mental illness. Are they allowed when you come back to put you on a probation period? Yes, they definitely can. Obviously, the company needs to look after its side of the street too. But I just want to reiterate that you will not get fired. You may not get fired if you reach out to your company for help. Um, and then, yes, those are your rights, basically. I just really want to emphasize that, seeing as we've got a lot of corporate members here, they can't fire you. As long as you get a note from a treatment center saying that you have been booked in here, and we will say you are booked in for illness, not for crack addiction, for illness, it won't follow you around. It's illegal. No one is allowed to disclose your bipolar diagnosis. So no one is allowed to disclose your addiction either. This is a mental health issue and there is help. There is help, and you are a human being who just needs your medicine. You're a diabetic who needs your insulin. Unfortunately, there's a lot of stigma, but in my very humble opinion, screw the stigma. This thing will kill you. So if you need help, there is many, many resources, and I'm happy to give you more after this talk. So I think I'm just going to leave it there for now. Thanks for letting me share.
Oh, wow. That's all I can say. Thank you so much, Shani, for this very, very informative presentation. I can see all the questions coming up in the chat box. It's unbelievable. And but at this stage, I think I'm going to ask: are there anybody? Is there anybody? Sorry, is there anybody who would like to ask the question directly to Shani? If there are no questions, I will start reading the questions and even the comments. Any questions? You can unmute yourself and you can ask the question directly.
I just wanted to find out, what are some warning signs that you can look out for when someone is nearing marijuana psychosis?
Okay, yeah, no, easy. So marijuana psychosis, again, it's like any other psychosis. So perhaps starting to talk to themselves, laughing, just laughing randomly at things that aren't really there. You might find their eyes roll a little bit, that they're not making sense, like coherent sense. You ask them a question and all of a sudden they're talking about numbers. They tend to talk about biblical things all of a sudden. Philosophical things start to come out. Numbers, they talk a lot about numbers as well. Yeah, they just start talking in a disorganized way, in a way that doesn't make sense. Then you already know, okay, listen, something in the mind is starting to twitch a little bit. Perhaps they're starting to hear things, see things. Yeah, that's normally what you should look out for if it's starting to get really bad, for sure.
Thank you. I'm sure that addressed your question, sir.
Yes, it did. Thank you very much.
Thank you. Any other
Uh,
questions?
yes, thank you. Shawnee,
Yes.
we have a son
Mm-hmm.
and he's been in rehab more than once.
Yeah.
And that was for, well, we don't know whether he ever used drugs. But I'm sure the marijuana was definitely
Mm.
something that he smoked and so on. And
Mhm.
alcohol was a big thing. And then he used that with his medication
Yeah.
that he was on. So, and it actually went to such a bad that he lost his job and everything.
I'm
So
sorry.
currently, no, thank you. Currently, he's living on the farm with his grandmother. So
Mm.
it's
Mm.
difficult for us. We don't have control over him. He says that he doesn't drink anymore, But we would, especially now, like you say, with the laughing or happiness or very, talkative and all of that, when we do visit them, we see those symptoms.
Yes.
So, and now he's gone to a government hospital, and they've actually given him medication for depression and things like that because he is a very dark person.
Yes.
So, yeah, and as you said, so it's actually really not going to help if he keeps on drinking.
No, it's going to
So,
serve no purpose whatsoever. I mean,
mm.
first of all, I think just so I can bulk it for I don't know how long he stayed in rehab for and so forth, but one thing,
2 weeks, yeah, at a time.
okay, no. I mean this with love.
Yeah.
Length of treatment is what gets them better.
Okay.
So the longer they're tethered to a treatment process, so primary,
Mm-hmm.
secondary, tertiary, aftercare, step down facilities, the longer
Okay.
they're tethered, the higher their chances are. So a minimum of 3 months. It takes a month for the brain just to catch up from all the
Mm.
damage. It takes two
Okay.
months to get off all addictive substances. So, for example, if he came
Okay.
to rehab, the first month we would detox and make sure that he's medically okay. The second
Mm.
month, we would wean him off all this ridiculous medication that they've put him on.
Mm-hmm,
And
mm-hmm.
then in the third month, apply the new coping mechanisms. So,
Okay.
if you're not sure, test him. I know it
Mm.
sounds
Mm.
crazy. Test him,
Yes.
randomly
Yeah.
test him. If he
Yeah.
denies a drug test, and this is the
Mm.
beauty of it, if they deny it, they've got nothing
They.
to deny.
Yeah. Yeah. Yeah.
So if they deny, you already know something's wrong.
Mm.
You can do the
Mm.
blood test route, but in all
Mm.
fairness, Lynette, your gut is right. Do
Mm.
not judge your gut. You know exactly what's wrong. Your gut is 100% right. If you
Yeah.
have an opportunity to get him back into treatment, I would
Mm. Mm.
suggest long term, meaning 3 months at a
O-
minimum.
Okay.
If
100%.
he's not willing to go,
Mm.
you can go the court order process.
Mm-hmm.
There is a court order way of going about it where we section loved ones and they don't have a choice. If they leave,
Okay.
they go to a holding cell.
Yes.
Um, there's a process. So if you want more about that,
Okay.
I can help you. But your gut is right. That
Mm.
medication,
Mm.
it's a waste of time if he's going to drink on it. It's
Yeah.
just a
Yeah.
waste. You could throw it in the dustbin.
Okay. Shani, thank you so much. Appreciate it.
No problem.
Okay, then we have a hand up from Mahudulela. Sorry if I pronounce your name incorrectly. You can ask your
Uh,
question.
yeah, no, thanks. It was actually a good attempt there. Um, so I have a situation. So if you know someone who is struggling with
Mm,
alcohol abuse, and I mean, you mentioned quite a few symptoms that I could relate to, where you show them a list of things and still in denial.
yeah.
And I mean, going the rehab route, firstly, I think the person needs to be accepting. But in that case, how do you then approach to say, okay, we need now help. We've done the medication, the
Mm,
psychiatrist's prescriptions, but I mean, it's like you said, you're counterproductive when you mix it with
mm.
alcohol, so it doesn't really help. But yeah, what do you do in that
So
instance?
yeah, it is tricky. I mean, we often say we wait until the person, your loved one, hits rock bottom. I mean, trying to force them is really, really tough. But if they really are making a mess of their lives and they're really, really uncooperative and you care for them and you'll do anything to help them, like I said, the court order route is one way you can go. You can do an intervention. So many rehabs have people that you can call that will come in and facilitate an intervention with him. So we'll bring in family members, we'll bring in loved ones, friends, everyone who's worried about them. And then with a facilitator who will come in and sit down and go, listen, your family's brought you here today because they are really, really worried. So just a couple of letters and just a bit of skill, you can get them to kind of commit to coming to treatment if you show them the necessary things. Um, yeah, if it's like you say, it's your friend. I mean, the only thing you can continue to do is be honest, but you can also put boundaries in place. Now, this is where the tough love approach comes through. If there's something like you won't tolerate, especially like parents as well, if you do this, if you continue to do this, then you cannot live with me. Or if you continue to drink and go down this road, I will no longer help you pay your medical aid. You can no longer live here. I will no longer be able to see you. I'm not going to cover up for you at work anymore. Whatever those kinds of terms and conditions are, you have to see them through. You have to. So you cannot threaten an addict and an alcoholic and not see it through, because they will take it as a joke. They will cry a little bit. They will just do the little remorse thing a little bit, and they know you will cave. So if you have some sort of bottom line or leverage with him, some sort of leverage, you can use that leverage, not in a nasty way, but to say, like, this is where my line is. This makes me unhealthy. I have done everything to help you. I have borrowed you money. I have covered for you at work. You know, this is making me unhealthy. And I'm letting you know now that if you don't go to rehab and if you don't do something about this, I unfortunately have to step back from this friendship because I'm getting ill. I'm getting sick. And there's this other dynamic that comes with addiction, that it affects everybody. So not only are they addicted to drinking and drugging, loved ones, friends, family, they start to become addicted to saving them. And you will realize slowly but surely that there is nothing you can do to save them. You can be there if they want to get better. You will support and love them if they desire to get better. But if they have no desire to get better, no desire to work on themselves, at what point does your well-being come into play? I'm sure you have a family. I'm sure you have people you care about. I'm sure your time can be spent dealing with people who really, really need it right now. And when he is ready, you will be there. I will be there. But when you are ready. And those are the
Yeah.
couple of options in a nutshell I think could work. But put boundaries down. You may not come into my house if you've been drinking. He comes and knocks at the door. But I told you, please get off my property. It's a no. And you have to hold it, because they're not used to experiencing consequences. Trust me, they're very manipulative. They can get away with consequences. But if you hold the line and you keep your boundaries, you won't get sick in the process. You're there if he wants the help, offer the help. But if he doesn't want it, wait until he hits rock
Yeah.
bottom. He'll come to you then.
Okay. Yeah, no, it's important. Yeah, I think I take that. I think what I always done is make those threats, but never follow through.
No, unfortunately, yeah. That sounds
Yeah.
about right.
So thanks.
You're welcome.
Thank you, Shani. Another question, another hand raised from Kate. Kate, you can ask your question.
Hi, Shani. I just want to say,
Hi.
wow, thank you. This is exactly what I needed to hear today. And I can really tell that you know your stuff. A bit of a rhetorical question, but why are they not making the dangers of alcohol not more widely known? I mean, like, come on. That stuff is poison in a bottle. But my
Yeah.
question that I've got for you is, how do you, when you've gone through that addiction and now you know that what the problem is, but you're on this whole spectrum of medication because it's all been thrown at you because you were in denial about what the real problem is. What do you do at this stage?
So if you have gotten better, so like I'm going to use my journey for example. So in the beginning of my recovery, I was diagnosed as bipolar, which we couldn't really tell because I was using drugs in the background. So in the beginning of my recovery, they treated me for bipolar. So I was on bipolar medication. Then I stayed clean. I got clean for about 6 months. And then I started to feel that the medication made me feel funny. Because for the first time in my life, it was actually working because I wasn't drinking or trying to cancel it out with something. And I was feeling uncomfortable. So then as time progressed, I then consulted with a psychiatrist and I explained to the psychiatrist that I'm in recovery. I am an addict. I do not want to be on anything addictive because I understand how my body works now. I'm allergic to that stuff. I will crave it every time I put it in my system. So please, can you either wean me off this stuff? And he will. He'll start to wean you 2 weeks, another 2 weeks, another 4 weeks. In that time, monitor you as well. If weaning is not possible, let's say you sincerely schizophrenia, you can't come off your medication. I don't care. You know what's going to happen if you come off your medication. You can then approach your doctor and say, listen, these are my chronic meds. I have to be on them. Can we maybe consolidate some of them? Do I have to be on 15 pills? Or can we like get that down to like 5, please? Or can you please put me on things that are non-addictive? Because there are non-addictive antidepressants, non-addictive anti-anxiety meds, anything non-addictive. That way it doesn't compromise your recovery. So either A, weaning process, or B, go ask them to change it to non-addictive medications. Because some people have to be on medication. It's not a joke, you know?
Okay, thank you so much. I appreciate your time today.
Thanks, Kate.
Thank you very much, Shani. Everybody, unfortunately, our time is up. We are only booked for an hour for this talk on this platform. I wish I could have given everybody a chance to ask their question, but I see there's still a lot of hands up. Can I please ask you to send your question to tempo@bestmed.co.za. We will send you Shani's email address. She agreed that we can share her email address, and thank you so much for that, Shani. And also, please have a look in the chat box. I've also typed the share call number, toll-free number of SADC. If you need to contact them, it's a service that Bestmed also offer their members. So please contact that number if you need to speak to somebody immediately or need help. And then also we will share this recording of the video to all the attendees within the next few days. And then I would like to say thank you once again, Shani, for this unbelievably informative presentation. And also to you as a member and our corporate clients, thank you so much for attending this session. And please note that our next talk is taking place the 23rd of August on women's health, and we hope to see you all there. So now have a lovely afternoon and please take care.
Thanks, everyone. Be well.
Thank you very
Bye.
much. Thank you. Bye.
Thank you.
Bye.
Thank you. Bye.
Thank you. Bye-bye.
Guys, bye.